So hi everyone, good morning. First of all, I'd like to thank the organizers. I think it's very inspiring to have this conversation today. I think all of us involved with the Chagas world and the neglected diseases world always welcome initiatives like this. So I'd like to extend my special thanks to my dear friend Daniel Pinto for his leadership in putting this together, for Paula to helping galvanize this with Jair here in San Diego, and it's really good for me, being a Brazilian physician, but now based in California, to have the chance to speak about Chagas and neglected diseases here. So thanks everyone, and it's really great to speak after Myra. It's always inspiring to hear her story. I think she's a great reminder for us why we're here and why we're doing what we're doing. And sometimes I think we need Myra's voice to resonate and speak to us. Like, you know, it's frustrating. It can be frustrating. That's why it's called neglected diseases. That's why it's not an easy thing to deal with. But we need stories like you, Myra. So I'm always very inspired with your stories. And thank you, Daniel, for walking us through the history of tropical medicine in Brazil and the contributions. And of course, today we're here speaking about a disease that owes a lot to the Brazilian scientists. And thank you, Paula. I think I don't need to add much to what you said, but I think the takeaway from your presentation is we're here talking about an American disease. And I think it's not a Latin American disease. It's not an exotic disease from the south of the Americas, but it's an American disease. And it's really an American trypanosomiasis. So we should not be setting a border. This is a problem of us and them, and we don't get together. But anyways, just an introduction. My presentation will really focus on the evolving challenges and the impact of migration and climate change, among other things, on Chagas and neglected diseases. I work a lot on migration issues and the intersection between migration and climate change and why they matter when we're talking about these diseases. So here, a reference to Berenice, as Daniel told us the story. She was the first person diagnosed with Chagas in 1909, so many years ago on this day. So that's why we're here today celebrating Berenice's diagnosis, and then it became the Chagas Day. And here are some faces of the disease and people who are striving to give information about Chagas to an affected person, people who are lining up. This is a picture in Cochabamba. It's Bolivia. It's the largest prevalence in the world for Chagas, and this is a health center there where people are lining up to get access to diagnosis and treatment for the disease. So it's not a coincidence that we're here today speaking about the impact of Chagas, not only by the numbers, but I started the presentation with the faces of these people. And again, having Myra presenting to us and really thinking of all the people who are affected. But also here, I think it's a very compelling, image of, you know, we're talking about over 6 million people that are affected worldwide by Chagas. And this is probably, as Paolo was saying previously, an underestimation, right? We're really taking the numbers of the known people or the estimate prevalences, but then, of course, the moment you start diagnosing, the moment you start opening up the funnel for better screening, you find more. So, but we're working here with like at least 6 million people infected all around the world. And of course, a lot of these infections are based in the Americas. And again, I'll be speaking about the American disease, not only the Latin American disease, but that, as Daniel also mentioned, Chagas now is a global phenomenon. It's you know, the diseases, the parasite doesn't respect border. There is no need for a passport or for a visa, so it will continue to spread, and that's why now you have countries like Spain, Switzerland with higher and higher prevalence, but also because of migration routes that have been well established throughout the years. For example, Brazilians and Peruvians going to Japan. There are a lot of cases increasing in that region of the world. So this is just a snapshot to show us where Chagas exists now. And then, of course, I think that talking about Chagas is important to think about the shadows of neglect and what is the intersection between Chagas and other neglected diseases. And of course, it impacts vulnerable populations, right? People who have long and chronic lack of access to healthcare, limited access to education. So, it's not a coincidence that Daniel showed that in Brazil, in the beginning of the century, majority of people were illiterate. There was no sanitation, poor health status. And then, of course, this is a big factor that contributes to the high prevalence of neglected disease among these populations. Of course, the lack of education provides a feedback into people not knowing about their risks to be infected. So it's very common that people say, I've worked in Bolivia, and I remember people saying, oh, my grandparents died of Chagas, my parents died of Chagas, but I don't know. Do I have Chagas, or do I test? They're scared, so there is a lot of stigma, and Colin has worked a lot on the personal perspective of Chagas and the medical perspective of the person's understanding and stigma of the disease. But then, of course, everything could be much better managed if there was more preventive actions, there was more screening, there was more awareness, and awareness both by the affected populations, but also, again, as Paula was showing us previously, providers' awareness. And that, being a Brazilian physician, having worked in many places in Brazil that were endemic for Chagas, I really didn't talk much about Chagas during my medical education. Maybe I had 1 or 2 classes of dedicated to Chagas, even though it was such a breakthrough. Later on, when I became a doctor and I really started to work a lot closely with my dear, brilliant Fiocruz friends, then of course, we talk a lot about it. But when I started working with Chagas, a lot of people asked me, oh, but Carolina, so you're moving now into a history of medicine? I said, no, the history is happening now, right? So it's really about the awareness in a lot of different levels. And of course, prevention is always better than cure. We've seen that over and over again throughout the history of medicine. And if we test people early, if we provide them treatment early, it's proven that it slows the progression of disease and really decreases the burden. Of course, in terms of migration, I already showed the map before, but I'm always a big fan of graphic representation, and that's where Chagas is. And of course, these are all estimates. So the biggest estimates are in the Americas, but you also have the disease spreading out in different places. And of course, the gray zone is always, there's no data available. So should we think that there's no Chagas there, or there's basically no data? And no data is data. No data is available information, right? It really should be a reason for us to start screening more. And then, of course, talking about Chagas and neglected diseases, it's all about, and I like the fact that we should be crossing the tropical diseases out of this, because it's neglected diseases. And then, as Peter Hotez has written many, many years ago in his book, Forgotten People, Forgotten Diseases. So this is about diseases that affect people who are oftentimes invisible, who don't have a voice, who don't have agency. And this is a group that WHO refers to as 20 infections. And again, tropical, but what is tropical, what is not tropical anymore because of climate change and all of the environmental changes that we're going through. But they have some very common features on these neglected diseases. And again, they're highly prevalent among the poorest of the poor. Even in rich countries, they are more prevalent in people who live below the poverty line, people who have low access to education, people who from minority groups. These are ancient afflictions, and it's really sad that we still have to be speaking about diseases like leprosy, like Chagas, who we see, in the Bible, like the leprosy, and we see references of so old, and we're still, fighting against those conditions. And not only that, they're growing, because as we see the inequality curves going up, neglected diseases will go up. So it's really impossible to speak about neglected diseases without speaking about development investments and development in sanitation, education, gender equality. There is also a feature on neglected diseases that women are more affected than men, and that has a lot of implications from a societal perspective, from a socioeconomic development. Can you imagine this girl? She's a girl who's in a refugee camp. She's a Syrian refugee, and she has cutaneous leishmaniasis. Can you imagine the stigma that this girl faces with this disfiguring lesion in her face? So, I've dealt with working with DNDi with women in Colombia, women in the Amazon who had similar lesions, and they're isolated from their communities. They would not have opportunities to go to school. There is so much impact that comes out of neglected diseases and these neglected populations. And again, it's both a cause and a consequence of poverty. So it's poverty promoting, it's a perpetuation of poverty. So are we talking of just a few people? Like, are we talking about a very rare group of diseases? Not really. There are many people affected by neglected diseases. It's estimated that at least 1.5 people in the world are affected by at least one neglected disease. And of course, having one disease, neglected disease, it doesn't mean, oh, I have my share, I'm not going to have any other. So a lot of people have overlapping infections. So it's very common in endemic areas, for example, of Brazil, of Latin America, even here in the US, someone has Chagas, but also has worms, but also gets dengue when it's high season, with the rainy season, and the mosquitoes are breeding. So this is just, I think, a good representation of the number of NTDs that overlap. So the darker the shade, the more diseases overlapping. And I think that really calls the attention for integrated approach for neglected diseases. Of course, there is a growing concern about people being pushed to move, people being pushed to migrate, the forced migration that really perpetuates the inequality. So people have to migrate either to different countries, like we see here, and I think Shiba will speak about, a lot of her patients having come from El Salvador, Guatemala, Mexico, who had, lived in poverty there, come infected, but also people who are forced to move within their country borders. So they have to go into urban settings. Sometimes, in Latin America, a lot of them end up going to slums or favelas, as we call, and the sanitation capacity is really limited, and that also becomes a breeding ground for more and more neglected diseases to be happening and to be progressing. And for example, very recently, there have been more reports coming out of Venezuela because of the deteriorating situation, socioeconomic, of Chagas being transmitted in the urban settings, in the favelas of Venezuela, in the slums of Caracas. So very serious, very concerning, and again, impossible not to mention the effect of climate change and the environmental degradation on that. Gets warmer, the vectors like it warm, that they will thrive in poor sanitation, they will thrive in bad conditions, and there is more risk for people. And of course, when we talk about the risk for people, it really affects their capacity to be educated, their labor capacity. So NTDs or neglected diseases are really known to be a factor of disability, very, very serious. So people are not able to work, and that really keeps them in a trap of poverty, lack of development, lack of opportunities. But of course, as Daniel said, there is reason for hope, and there are a lot of important goals, like the Sustainable Development Goals, not only the number 3, that's for health, but all the others that really intersect in how they connect with neglected diseases, and how that is a key component of fighting neglected diseases, is a key component to achieving sustainable development. This is just I think it's always a very important graph for us to think of research and development for neglected diseases, and that's quite stunning. Like when you think about, from 75 to 99, only 1% of all the new drugs registered were for neglected diseases, right? This includes malaria and TB, because if you take malaria and TB, it's even less than 1%. And then the same research was done by colleagues from DNDi and Doctors Without Borders. They looked again a decade later. So there were more products registered, but still, like only 1% of the new chemical entities, like the new medications, have been approved for NTDs, malaria, and TB. So there has been some progress, yes, but I think, again, having people like Jair and others today speaking about what we see in the future and what's the pipeline for new potential drugs. Just very briefly mention to the global funding for NTDs. I think it's important. Every year there is a report from Policy Cures Research, and I really suggest that everyone gets familiar with it, because it's really a great way to understanding where the money goes for R&D and how it really, there is, not all neglected diseases are born equal, unfortunately. So yesterday we were at the UCLA event, and there were some questions. So why does Chagas get so much less funding than other diseases? And of course, this is a great reason to understand the priorities of the global health agenda. What's the most complex types of diseases to deal with than, for example, diseases that you can go and do mass drug administration, like some worms. But I think here is very interesting to see, the Chagas is the light blue. So yes, there have been some little progress, but look, just very little. And then of course you have the diseases that get more funding, like HIV here, TB, and then other types of diseases. So really you see that even within the NTDs, you have the most neglected. And then maybe I'm approaching the end here, but just to say that the major drivers of neglected diseases are really like the conflict. Conflict-affected populations are more affected by neglected diseases, climate change and environmental degradation, and then poverty in the middle of that. And then the concept of blue marble health was coined by Peter Hotez some years ago, and it's very much like what Paula was just saying about the One Health. So it's the intersection between the environment and human health, and how one is not possible without the other. So we have to strive for that. And I think now more and more, when you see the resolutions from all of the big meetings on the environment, there is a consensus on that. And of course, climate change will fuel neglected diseases, but infectious diseases in general. But not only that, also other types of consequences in human health, including asthma, respiratory conditions, and there are a lot of research now going on about areas with higher pollution rates had worse COVID outcomes because potentially of the overlap between these two conditions. Of course, a lot of people who live in areas with severe climate change and environmental degradation are being pushed to situations of food insecurity. So a lot of people, and it's also one of the drivers for migration, a lot of people in Central America, in the Northern Triangle, Guatemala, El Salvador, Honduras, have to leave their lands because their livestock are disappearing. They can't grow anything anymore, so they have no other option sometimes than to move, to be forced to move. And of course, the climate change and environmental degradation will be a feast for malaria, for dengue, for hantavirus, for all of these diseases, chikungunya, Zika. I just came back from Brazil. Dengue was again going up and up. And then I think just finishing with some word of hope, the WHO has set very ambitious targets for neglected diseases, and it's all included in the NTD's roadmaps. And I think, again, it's been an effort to integrate. So I think it's the integration of neglected diseases into primary healthcare, into other programs, but really using that cross-cutting approaches. So it's been seen that the vertical approach, like I go into a country, I work on Chagas, and then, or I work on sleeping sickness, and then I don't talk to the people who do malaria, or I don't talk to the people who do vaccination. Doesn't work. You have to integrate, you have to optimize resources, logistics. We're talking about countries like Congo, like Cameroon, like areas where it's very hard to get. And then, of course, really, and I think that has to do a lot with, the conversations nowadays of decolonizing global health and decolonizing health structures, and really ensuring that the countries have ownership, and the leadership of the country is in charge. So with that, I thank you very much, and it's been a pleasure.